हेलो दोस्तों, मैं आज आपके लिए ओस्की के लिए असेसमेंट के लिए वीडियो लेके आई हूँ कि आप कैसे ईजीएस्ट वे के साथ असेसमेंट को लर्न कर सकते हैं और आप एग्ज़ाम में इस वे के अकॉर्डिंग आप कोई भी पॉइंट मिस नहीं करोगे अगर आप इस वे के अकॉर्डिंग याद करोगे इसको। मैंने अपना उसकी एग्ज़ाम इस असेसमेंट को याद करके इस वे से ही दिया था, तो मैंने क्लियर कर लिया था अपना फर्स्ट टाइम उसकी एग्ज़ाम. So I will also recommend you to please follow these points if you want to pass OSCE exam assessment in the first time. So as we can start from the uh, as in the A to E assessment, we can start from the airway. So firstly, as after saying to the examiner about the hand hygiene or doing the hand hygiene and saying the scene is safe for me to enter, go to the patient. Firstly, introduce yourself to the patient and then check the patient and also say the reason why you are uh, there for the patient as for doing the assessment from A to E assessment. And then you will do the full ID check of the patient and with the allergies, and also don't forget to check the patient wristband against the documents and also check the allergies against the documents and say that I can see that you have red allergic band, so you are allergic to this medication. And after that you can see point third, you can ask about the comfort of the patient. Are you comfortable or have you any pain? Then if patient said that I have pain, then you will ask from the patient about the pain scale, where 0 is no pain and 10 is the severe pain. Then you will say to the examiner that if as the patient is talking to me, as I can see that his airway is clear and I can't see any visual obstructions. So you will move to the breathing, and under the breathing you will firstly check the breathing respiratory rate of the patient manually for the full 1 minute, including the characteristics of the breathing. Is their patient is using any wheezing, or is there any coughing, use of accessory muscles, sweating, sinuses, rhythm, and that everything you will say to the examiner that everything is normal. Or if the patient is using accessory muscles, then you will say that patient is using accessory muscles, everything. Then you will check the patient's pallor, is that yellow, pink. If it's a black patient, then you can say the patient that could you please put your tongue out for me so I can check the pallor of your tongue. Is that if the tongue is red, then you can say that I can see that tongue is red, so it's normal. Then you will proceed to the next circulation. In the circulation, first of all, you will check the BP of the patient. As you are checking the BP, taking the curve from the monitor, and then you will ask from the patient, is there any surgery on the arm that you are going to check the BP. Also check the capillary refill of the patient for full 5 seconds. Press the finger for 5 seconds and let it go back in less than 2 seconds, then it's normal. Then check the pulse rate. Put the saturation probe on the patient's finger, check the pulse rate and the saturation. Then you have to also do the pulse rate check for manually for 1 minute, and also check the characteristics of the patient pulse rate, like is their pulse is weak, thready, normal, or bounding, anything. You will verbalize to the examiner that pulse is normal, pulse characteristics are normal. Then you will proceed to the disability part. Under the disability you will check the alert, confused, voice, pain, unresponsive. If patient is alert as talking to you and follow your commands and the patient is alert, you will say to the examiner that my patient is alert as talking to me And if the patient is like, for example, if you got the patient of GCS like subdural hematoma, then already patient is confused, then you will say that patient is confused, or check that, ask the 2 or 3 questions from the patient. If the patient is have head injury, then you will ask where he is, what the time is. Then you will ask about the pain with the pain scale, and you will check the blood glucose. Not really do really need to check the blood glucose, but you will ask from the examiner about the blood glucose levels of the patient. Then you will ask from the patient about the urine output problems. Is there any problem with the urinary elimination? Then go to the exposure, you will check the temperature, and then do the head to toe assessment, and ask from the patient about is there any bleeds, rashes, cuts or wounds around in on her body. And don't forget to provide the privacy to the patient before checking the do the head to toe assessment. While we are not going to expose the patient in the OSCE exam, but we have to only ask from the patient about the head to toe assessment, any bleed, rashes, cuts or wounds. But we need to provide the privacy or verbalize to the examiner that before doing the head to toe assessment, I will provide the privacy or close the curtains from the for the patient by asking the patient, can I close the curtains for you. Then you will go to the medical history, ask about any diabetes or hypertension, any medical history of the patient. After you have got all the points, then you will fill your news chart or the GCS chart according to the observations you get through in this assessment. And after filling the news chart and the GCS chart, you will go to the physical check. Ask from the patient, is she or he have any mobility problems, or he or she is using any walker to moving. Or you can also see from the scenario of the assessment, all things are written there. And after that, secondly, you will ask about any appetite problems, whether patient have any eating or drinking problems. Then you will also ask about the, is there any issues in elimination. Then you can proceed to the psychosocial. There are 3 things to ask from the patient about the psychosocial, like whether he lives or alone or with any other, with wife or with children. Then you will ask about, is there any pet at home like dog or cat. Then you will ask about the any patient have any smoking or drinking habits. If the patient is smoker, chronic smoker, you can also ask about smoking cessation program or smoking cessation services. In the spiritual or sexual, you have only one question you can ask from the patient. In the spiritual, you can only ask, do you believe in any religion? And in the sexual, you can ask, do you have any concerns related to your sexual health? And that's it. So it's the easiest way to learn. So you can learn these points, and it will be very easy for you to take the assessment. सो अगर आप नेक्स्ट वीडियोस ऐसे ही ईजीस्ट वे के साथ चाहते हो कि आपको ओस्की का एग्ज़ाम ईजी लगे और आपको एवरी सिनेरियो और एवरी क्लिनिकल स्किल्स आपको ईजीस्ट में मैं बताऊं, तो आप प्लीज़ मेरे चैनल को सब्सक्राइब कीजिए और एवरी वीडियो को लाइक कीजिए. थैंक यू सो मच.